Should I get eyelid surgery for my asymmetrical eyes? I'm a 20-year-old Asian male, and I have a double eyelid on my left eye, but a single eyelid on my right eye. Should I get double eyelid surgery for my right eye? Will it correct my asymmetrical eyes?
Thank you for your question. You submitted a good close-up photo of your eyes and you said you're 20 years old, you have a defined crease in the left eye, and you have not a defined crease in the right. So you're asking, should you do the procedure to get the crease? Well, I can certainly tell you about the procedure that we would typically do for someone like yourself, and the decision on whether or not you do it is purely a personal and aesthetic decision. As a bit of background, I'm a cosmetic oculofacial plastic surgeon. I'm a specialist in eyes, and Asian eyelid surgery is one of the areas that I've done a lot of work in, and I spend a lot of time in practice focus on this area. I can tell you that someone like yourself, when we look at Asian eyelid surgery as a broad concept, we just basically have a decision tree that's very straightforward. Is there extra skin? Is there fat? And based on that information, do we choose to do an incisional versus a non-incisional procedure? And then once we decide that, what kind of crease do we want to create? Do we want to create a nasally tapered crease, a parallel crease? And that's basically distilled down. Now, of course, there are a lot of variations, or a lot of different options. But basically what I try to do is maximize symmetry. So someone like yourself who's only 20 years old, most likely you don't have extra skin and you don't appear to have extra fat. So we would probably do a non-incisional procedure. Now, non-incisional is a little bit deceptive because there are little openings made, but instead of cutting out skin, we're actually making little openings along the crease. And what we're doing is we're passing a stitch under the skin and then taking it out from the underside of the eyelid and then bringing it back and creating a loop. It's the basic, I should explain this, basic issue with Asians who have a crease versus Asians who don't have a crease has to do with the anatomy of a muscle called the levator muscle. The levator muscle is the muscle that lifts the eyelids. From that levator muscle are fibers that go to the skin that are responsible for creating that crease. So what we're doing with Asian eyelid surgery is creating that crease. Now, that being said, it is that procedure is a local anesthetic procedure, usually with maybe a little bit of sedation. So I think in determining whether or not you want to do it, understanding the surgery will give you a certain sense of whether or not you want to go through that, and understand that the healing process typically is a process where some swelling can linger for several months after the procedure. So you might have some swelling, but you'll likely have swelling from the eyelash to the crease that can last at least a month, that can be obvious, and then it can be at a low grade for a couple of months after that. So the bottom line is, I think you should meet with a doctor who specializes in Asian eyelid surgery, learn your options, and figure out if you're comfortable with that and if you desire to have that right upper eyelid crease enough to go through the process. So I hope that was helpful. I wish you the best of luck, and thank you for your question.